This is the second video of the skull. This video covers the facial bones. In a previous video, we covered the cranial bones. So if you look at the skulls, remember they look like this. And we divided these bones up into cranial bones, which form the cranium. There were 8 cranial bones. The other bones are either facial bones or associated bones, and we're going to cover those in this video. But there are 14 facial bones. So if you blow them up, they look like this. The first facial bone we're going to cover is the mandible. This is the lower jawbone. Well, in adults, this is a single bone, but in children, it's actually 2 bones. Fusion, though, happens in the center, right underneath the lip. You can see that bone here on the skull. So if you look at this bone, the most obvious thing about it is that there are teeth. Each tooth fits into a socket, and the socket is called an alveolus. And so the whole area where these sockets are is called the alveolar process, or alveolar margin. We also can see right here is where the 2 bones fuse together. Originally, this was a symphysis joint, which has fibrocartilage in it. But in the adult, all the fibrocartilage has been replaced with bone, but we don't change the name. It's still called the mandibular symphysis. On either side of that, we can see holes, one on each side. Remember, the name of this bone is the mental, or the name of this area, the chin, is the mental. These are called the mental foramen. And there's a nerve which goes in through here. So if we look at the bone, this is that bone. If we look at it from the side, what we can see is this part of the bone, which goes all the way around, about 2/3 of the way around. This is the body. But then there's a part which goes upward, and the upward part is called the ramus. Right where the body and the ramus meet is called the angle. So we have body, angle, ramus. If we follow the ramus all the way to the top, we can see that it splits, and there are 2 processes that are formed. One is anterior, and it's kind of pointy. That's called the coronoid process. One is posterior, and it's rounded, and that's called the mandibular condyle. There's also this dip or cutout between the 2. A dip or a cutout at the edge of a bone is usually called a notch, and so this is the mandibular notch. So if we take the bone off and look at it, we can see those different parts. We can see the body, the ramus, the angle. We can see the alveolar process, the mental foramen. We can also see where the ramus splits up at the top, and we have this coronoid process and mandibular condyle along with the mandibular notch. Well, if you look on the medial surface of the ramus, you're going to find another pair of holes. And this is where the nerves that supply or come from your teeth and your lips and your cheeks come out. These are the mandibular foramen. And here you can see those mandibular foramen. Because this nerve carries all the sensation from your teeth, when you go to the dentist and they want to numb your teeth, this is where they do the injection for each side. The next bones we're going to look at are the maxilla bones. There's 2 of these. They never fuse together, but these form your upper jaw. They also go all the way up and form part of the eye orbit, and then they also are on each side right underneath the nasal bones. So when you look at them, they look like this. You can see the teeth, you can see the nasal cavity, you can also see the upper part of your mouth, and so on. In this picture, there are these purple bones. So if we look at these bones, again, the most obvious thing about them are these teeth sockets. And remember, each socket is called an alveolus. So once again, we have an alveolar process. We also have the bottom part of the eye orbits. Remember, the top parts were called supraorbital margins. Well, these are the bottom, inferior, so these are the infraorbital margins. Remember, there was also a pair of holes up at the top. Well, there's also a pair of holes here. And these are called the infraorbital foramen. And the nerve that carries the sensation from this part of the face goes through here. If you look in the roof of your mouth, what you can see is the mouth. If you put your tongue up in the roof of it, the first part of that roof of your mouth is hard. It's called the hard palate or bony palate. Well, if you look here, you can see sutures. So the front part of this, the anterior 2/3, is made up of this maxilla bone, but the posterior 1/3 is a different bone. If you look right behind the two front teeth, you're going to see a hole or a fossa. Those teeth are called incisors, and so this is called the incisive fossa. The rest of this bony portion here, again, the anterior 2/3, is the hard palate. And so since it forms the hard palate, this is called the palatine process. Remember, the posterior 1/3 are different bones. The bones they are these bones. These are the palatine bones. So they're called palatine because, again, they help form part of this hard palate. So they form part of the roof of your mouth. They also form part of the sides of the nasal cavity and even go up and form a small portion of the eye orbit. They're sort of L-shaped. If you look at them here, remember this is inferior, so it's upside down. But you can easily see this posterior 1/3 of the bony palate. That posterior 1/3 of the bony palate is called the horizontal plate. You can also see up at the top of this bone something called the orbital process, and that forms a tiny portion of the eye orbit. The orbital process is not on your checklist. But here's what those bones look like for real. And it's easy to see these palatine processes, these horizontal plate. So there is the maxilla bone. That is the palatine process. But this is the palatine bone, and it's the horizontal process or horizontal plate of the palatine bone. If you look on either side of this, what you're going to see are holes. Most people have two, but sometimes there are three holes here. There's a big one and either one or two small ones. The big one is called the greater foramen. The one or two small ones are called lesser foramen. There are a few of these bones where you don't have to know any processes. All you have to know are the names. And this is one of those bones. These are the zygomatic bones, sometimes called cheekbones. In this picture, they're the yellow ones. You can see them here very well. And look, they're connected to different bones. They're connected to the maxilla, they're connected to the frontal bone, they're connected to the temporal bone. And so there are processes that extend toward each of these bones. Another pair of bones that all you have to know about is their name are the nasal bones. They form the top part of the nasal of your nose. When you look at them, these are the nasal bones. They're sort of rectangular shaped. They're not very big. Most of your nose is not bone, it's cartilage and connective tissue. But the hard part of your nose, where maybe your glasses would sit, those are the nasal bones. This is what they look like if you take them off. Another pair of bones, which you only have to know the name of, are bones that are just inside the eye orbits. They're just inside the corners of your eyes, and they're about the size and shape of a fingernail. They're not very big at all. So if you look at them, there's the lacrimal bone. Well, the word lacrimate means tears, and the reason the lacrimal bones are called that is because there's a canal that allows your tears to drain through it. And you can see this arrow is pointing at a little canal. That's the lacrimal canal. You can also see it on this. If you take the bone off, you can see this little indented area inside. That's the lacrimal canal. Another bone is the vomer. So the word vomer means plow, and it's shaped very much like a plow. Well, this helps to divide your nasal cavity in half. It forms the inferior part of your nasal septum. And so if you look here, you can see this septum. Now this skull has a deviated septum, but the top part is not the vomer. Only the bottom part is the vomer. The top part is the perpendicular plate of the ethmoid. So when you look here, those two are colored differently. The green is this perpendicular plate, and the orange is this vomer. If you look at the vomer in the posterior portion, it's actually bigger than it is in the anterior. So here's our palatine process, our horizontal plate of the palatine bone, and then right in the very center here is the vomer. So that's the vomer. Another bone or pair of bones that you only have to know their names are the inferior nasal conchae. So remember when we looked in the nasal cavity, we saw three things hanging down on each side of the perpendicular plate. We had the perpendicular plate, and down at the bottom we have the vomer. We have the superior nasal conchae, inferior nasal conchae, but there's a third pair, and that's these. These are the inferior nasal conchae, and they're separate little bones of their own. So when you look in there, there's the inferior nasal conchae. So nasal bone, lacrimal bone, perpendicular plate of the ethmoid, vomer, and then you can see the middle nasal conchae and the inferior nasal conchae in this picture. If you take them off and look at them, they look a lot like seashells. And again, that's why they're called concha, or plural is conchae. So just like we did with the interior of the skull, you can name all of the holes on the anterior part as well. And so this is another little place for you to come and do a little self-quiz. There are also 7 associated bones. So there are 3 tiny little bones inside each ear, and if you look at them here and compare them to the size of a dime, you can see just how small they are. And then there's a horseshoe-shaped bone in the neck near the Adam's apple. That bone is called the hyoid. And the hyoid bone is a little bit different from all the other bones because it's not directly attached to any other bone. It's sort of floating there, held in place by ligaments. Again, it's the hyoid bone, and you can see here what it does. There are muscles that go from the hyoid up to the styloid, and when you swallow, the muscle contracts and lifts this up. And what that does is it helps prevent food from going down into the larynx and trachea. The 3 tiny little bones in the middle ear are called earossicles. And there are 3 of them, and they're named for their shapes. If you were in elementary school, you might have learned these as the hammer, the anvil, and the stirrup. Well, that is their names, but their names are in Latin. They're the malleus, the incus, and the stapes. And what they do is they vibrate. When sound hits your eardrum, it causes these three little bones to vibrate. So when you look at them, here is the malleus, the incus, and the stapes. So the malleus in this picture is labeled C. The incus in this picture is labeled B. And the stapes in this picture is labeled A. These are not bones, but in bones we have hollow spaces that are filled with air. They're called sinuses. They're called paranasal sinuses because they're attached to the nasal cavity. And what they do is they allow air to flow in and out of these spaces. We use these sinuses for two reasons, or have them for two reasons. One is to lighten the skull, to make it lighter. The other one has to do with sound. They act like sort of like the body of a guitar. Sound resonates here, and it changes the timbre, the pitch of your sound. It also changes the loudness of the sound. And so if you look here, they're named for the bone that they're located in. So we have frontal sinuses, ethmoid sinuses, sphenoid sinuses, and maxillary sinuses. So if we were to do a sagittal section through the skull, we should be able to see these hollow spaces, and we can. So here is a frontal sinus. Here is the ethmoid sinus. There's the maxillary sinus, and here are sphenoid sinuses. The other thing we're going to talk about in this video is the fetal skull. So when we did the pelvis, we already talked about how the pelvis has to be open in the female so that the fetus can pass through it. But the fetal head is the largest part of the fetus. And if it's too large or too rigid, it might not make it through that canal. And so in females, the canal is open and unobstructed. And the fetus is malleable. It can move. Well, what makes it able to be moved is that the bones have not grown together and interlocked. There are soft spots between these bones. These are called fontanels. And there are 6 of these. There's 1 anterior, 1 posterior, 2 sphenoidals, and 2 mastoidals. And so if you look here, you can see the sutures, and you can also see these fontanels. And so look, none of these bones are interconnected yet. And so if you apply pressure to them, they move. And that's exactly what happens during childbirth. The uterus pushes down on this fetus, and as it's pushed through the birth canal, the head of the fetus changes shape. It moves around so that it doesn't get trapped inside the pelvis. Again, there are 6 of these. We have 2 sphenoidals and 2 mastoidals, and 1 posterior and 1 anterior. Now the largest ones are the posterior and anterior. The other ones are fairly small. But you should be able to name these. So here's a little self-quiz for you to be able to name these as well. So that's the end of the video.